staff and all these mugs, but okay.
Yeah, it's nice if you can just share your screen.
All right.
Let me go over my stuff first, though, Andy, here, and then we can do that if you don't mind.
Okay.
Well, it's 1 o'clock.
is that
Why don't we go
sufficient?
ahead and get started? I know you have a lot to go over.
Okay. Well, good afternoon, everyone. Long time no talk, I should say. A couple weeks. And so last time when we were talking during our rotational meeting, we ended up running out of some time on. We were talking about we're having a medical discussion on medical issues in the jail. So there are a few other items that I'd like to go over with you guys real quick, and then we'll just transition into that and spend most of the time talking about that. But just real quick, I just wanted to let you guys know, as most of you probably know, the polling sites opened up today, and we've got some of our staff just kind of checking on those regularly to make sure that we don't have any issues, checking in with the poll workers and stuff like that, and that all seems to be going fine. Just going to kind of give you a little bit of an update on our overtime budget. Our overtime budget is getting, as we get close to the end of the year here, it's kind of coming down. We're still fine right now, but it's kind of getting a little tight. Of course, the majority of that is because of the amount of people that we've been down and people coming in and filling shifts. But, we should be able to, or we might have to make some adjustments going forward on some line items to maybe move or, take some from somewhere else. I'll keep Mary apprised of that and Robert as we go forward. So let's see here. COVID impact. I talked with Chad. I don't know if he's on here yet, but I talked with Chad last week, since he's on the that coalition that's dealing with the COVID issues in Cass County. And basically what I had brought to his attention was we're having some issues or some time issues with some of our staff that's getting exposed. So for example, if I go over to Robert's house one night and we hang out, and I come back to work the next day, and then Robert finds out that he's COVID positive, and he calls and lets me know. And then of course, how everything is going right now, then I have to quarantine. We do that, our staff is then going in and getting tested so we can try to get them back to work quicker. But of course, there's a little bit of a period of time there where they can't go get tested because it might not be detected. There's a few days there. And then once they go get tested, those results get sent out to the state, and the state has been pretty backed up on running tests. So we're looking at sometimes like, a 7 to 10 day turnaround on getting our employees back to work. And that's been really tough on us right now. So I reached out to Chad and asked him if there was any way to speed up some of these results when our staff gets tested so we can get them back to work quicker. And so he was working on the state with that. And as most of you know, like at Sanford, they could get their test back within that 3-hour period. The state doesn't have that capability yet, so we have to wait for the results to be transferred out there, or the samples, I should say, and then get the results back. And like I said, that's causing an issue for us staff-wise. We've got several staff out right now waiting to get results back, and they can't come back to work. So he's working on that with us.
Why can't we use Sanford? Maybe if Robert, maybe you know.
We have reached out to them, and they say that it's mostly for their employees. Law enforcement doesn't fit the bill on it right now. But my concern, of course, comes that if we get 8-10 people out that have been exposed and they're just waiting at home, and that's a lot of our staff, and they're already down 7 people, then that's a 15 person turnaround on those that can't be at work with the amount of people that we know and spots that we have open, and then those waiting to get the results. So we'll see what Chad comes up with and go from there. Hopefully he can get something figured out for us. Let's see, there's Robert, did you want to talk about this Alertus? The Alertus information, or do you want me to do that?
Either way, I would just say it's a regular agenda item this afternoon, 3:30. Potentially could have been a routine business item. I just thought it was worth the conversation to discuss with the board really what we're doing, and this new tool that we're going to bring forward to have essentially panic alarms mounted in, what did we say, 65 desks, and then we have an additional, I think it's 10 to 15 panic button stations that are fixed mounts in facilities around around the buildings. Just really a tool to allow people to let law enforcement know ASAP if there's a problem that you need to respond to.
I'd like to talk about that a little bit.
Okay, do we want to talk about this now, or do we want to, it's on the agenda for this afternoon's commission meeting?
Well, you make the call.
I mean, it makes no difference to me. I'm just, you know.
Okay, well, so when I look at that and I ask myself, what is the circumstance under which that would be, someone would push the panic button? And then how many situations like that have we had in the past where we would need that? Maybe that's for the sheriff.
Yeah, so I'd have to pull that information for you. You know, I'm not sure how many times we have activated the alert system, but I can certainly get that for you so you have it at the commission meeting if you'd like, Commissioner Pollack. The whole goal of it, I think, as you probably know, is to just make it a little bit easier for our staff to obviously activate the system so they can get help if, you know, should they need it. And a majority of the thought process is more on the lines of an active threat situation where we have someone that makes it into the facility and is actively threatening our staff somewhere inside the building. So, but as far as how many times we've actually used the system, I don't have that number for you, but I could certainly get that for you and let you know what those situations were. This just makes it a little bit easier for the Cass County governmental staff to be able to access the system.
Well, the only thing the thought that I had as I was reviewing the information for today's meeting is, it's a secure building. You can't get in or out of there without going through a detector, a metal detector. And all of the access points are locked. There's a camera every place. I mean, there sure might be a situation where you need this, but I'm sure there'll be 100 false alarms for whenever there is a need for it. And I honestly don't see it.
Mary, can I bring this together?
Commissioner, can I jump in?
And Robert, yeah.
The one thing that comes to mind for me, and this is something that really I noticed when I first started and started touring around different departments, and particularly over in the annex building with human services, you've got a lot of caseworkers and employees who meet individually with clients in very small offices that have windowless doors, and there are times that people get agitated when they're in that situation and having that meeting, and there is no obvious way for a caseworker or somebody in that case to be able to alert somebody other than hearing raised voices. You know, I think you're right. I don't believe we've had a bad outcome somewhere like that in that vein since I've been on board. But I know Mr. Burdick would also tell you that there are occasionally instances where people may be fine as they come in the building and they present very normally at the secure entrances, and they're maybe up talking to them at the state's attorney counter or at the clerk of courts counter, where they become worked up, and that results in a call down to security desk. I would agree that we're not talking about something that happens on a daily occurrence, but it is something that has been brought to my attention.
Heather, did you have something you wanted to add?
Well, I've run into a few different instances, and Robert knows this too because I've told him about it, where people become agitated and they get in your face. And sorry, that's scary. So I'm not going to pull the alarm unless I need to use the alarm.
And I would just echo what Robert said. It would be for those circumstances, Commissioner Pollock, just, we're very much like you said, we're at the doors with our security team. But it would be for those instances where people get by and then become agitated somewhere else in the building, and we they made it came through the security checkpoints fine, but then at some point became agitated and upset with staff somewhere along the line. So
Okay, and now without having the panic button, how would the response, how would that be handled?
So right now, we do have alertus at some of the desks, so hopefully an employee who would witness someone else arguing with a fellow employee would report it to us so we could come up and intercept that way. They may call on the phone down to the security desk. They may walk out and try to grab one of our guys and have them come to that area. So there's a number of different ways that they would do it now. The alertus system would obviously be a little bit more efficient and give precise locations. And that person could activate that button without alerting other people that they're doing it. So that might be also another advantage to the system.
Is this a function that's available on the alertus software on the desktop?
It would tie in with that system is what would occur with it.
So in other words, instead of punching the computer, they would punch the panic button.
Yes, in some instances, yes, where they would have access to that. I don't know, Joel, do you have any other information? Joel Stading's been one of the persons that's been working on it for us, but yeah, that is very accurate as to what you had said, Commissioner Pollock.
Yeah, thank you, Sheriff. Good afternoon, everyone. So right now with the panic system that we have, wherever they're set, that goes to just the central location of the security desks and then down as well into court holding. So those three locations would get notified if someone has an issue. Then at that point, security desk sends it out either on radio or whatever to get it to us. With this new system, with the alertus, it would go directly to the deputies' cell phones as well. So we would all be notified at the same time instead of having to get notification at the security desk and that transferred to deputies that are in the courthouse or annex.
Okay. Is this an annual contract, or is this all these are hard costs for getting it set up?
I'm not exactly sure to speak for the IT department on that, but I believe in the meetings we've had, it's just one single cost. There's no like license fees or yearly contracts or anything like that. But again, that's just what I heard in the initial meeting that I attended.
Commissioner, the PO that is included in the briefing material for the 3:30 meeting, that's the purchase price of the hardware that would install these panic buttons and other equipment. And I need to defer to Terry for specifics on this, but we already utilize the alertus system, and so we're paying some level of subscription or management fee to them at this point. And I don't know if there's a per unit element to that would increase with these, but there is a cost here that exists currently.
Okay, thank you.
All right, any other questions from anyone? Okay, I'm going to dive into the medical situation that we had started discussing, at the last rotational meeting, and where we had to end the meeting. And so we'll kick off with that. I'm just gonna kind of give an overview of it, and then I'm literally going to turn it over to Captain Frobig, because he's out at the jail every day, and he has more of the issues down in the weeds, so to speak, issues that they encounter over there. So What I had started mentioning at the last rotational meeting was that I wanted to bring the nursing contract to the forefront, and that some of the issues that we're experiencing with the current contract or possible staffing issues were causing some problems for some troubles at the jail for our staff. And so what some of those were is we have a certain amount of staff that are contracted through Cass Public Health to service our jail and provide those services. They have taken on some additional responsibilities with all the COVID situations that we're running to out at the jail, some additional tasks that they've had to deal with in those regards. And that's pulling them away from some of their other duties. In addition to that, we have some of the nursing staff that is either shortly going to be deployed on military leave or, through taking their vacations or other things that they're involved in, sometimes leaves us short. So what happens in some cases is that our staff who, and when I say our staff, our correctional officer staff, they are certified to hand out medications to our inmates. On occasion, some of our staff has made some mistakes in handing out medications. They've either handed out the wrong medication or handed out medications sometimes to people who weren't supposed to get those. And so every time that one of those instances has happened, we investigate that internally in our agency to try to identify why that problem would have occurred, to see if we could come up with a better way to do things as we move forward. A lot of times those mistakes are occurring because of the amount of medications which have to be handed out. They could occur because one of our staff doesn't understand maybe some of the instructions that were left to them by the medical staff. Or sometimes they just make a mistake because of the amount we're doing in the time constraints that they're on, and sometimes being short-staffed. My concern as the sheriff is that someone is going to get hurt from that situation, and that the county may be looking at some liability. So I've been working with Andy now for some time to try to come up with a solution to this, and it always seems to come back to the fact that we tend to be short or not have nursing staff on site when these medications need to be passed out. And the other thing that sometimes is happening is in trying to prevent some of these mistakes from happening, we've been assigning a shift supervisor to oversee the way that these medications are being handed out at different times. And when that happens, then that leaves us a little short up in the booking area where people are coming in and being booked in, where the releases occur. And so then we lose a supervisor that's available to basically supervise all staff in the whole facility for that time that they're helping pass out medication. So it's kind of a snowball effect or downhill effect of some of the issues we're dealing with medical staff. And so I brought this to Mary's attention, and she posed some ideas to me. But really what I think we need to look at maybe is the nursing contract and hours, availability, what they're all doing out at the jail and why they're so busy and why we can't always have them handing out the medications. And so for that reason, that's where I'm going to now turn it over to Andy, because he's out there every day dealing with the situation where for me, it's occasional and I just hear the complaints from him and his command staff and simply have been trying to work through those. So I'm going to turn it over to him because it becomes a lot more confusing than my generalization and how I explained it to you. So Andy, I'll turn it over to you at this point.
All right. If I'm getting ahead of anybody, please stop me because I got a lot I got to go over here. All due respect to the sheriff, I think while I certainly share his concerns, those concerns are a minor symptom of a much larger condition or situation that we have out here right now, only compounded by the COVID stuff. Just want to give you a little bit of perspective here, or context of what we're talking about. So I'm going to share a couple things with you here. Just the one titled Jail Staffing as of 10/19.
Yep.
Okay. So we have currently 4 staff that are on quarantine, that are officers, social workers out till November 4th. Our mental health coordinators out till October 26th. Our 24/7 deputy, I was just informed today, is testing because he's symptomatic, and I have 3 other officers on top of that that are possibly quarantined due to pending in-house family testing results. We've got 2 on light duty, 7 vacancies, full-time, 1 part-time vacancy, 5 rosters, 1 military leave. Of our currently allocated nursing positions, 2 full-time RNs are both filled. However, 1's on light duty due to breast cancer. And she's also going to be out because she's having surgery on Wednesday. Unknown how long she'll be gone. 1 part-time RN is filled. 3 out of 4 LPN positions are filled. 1 is vacant. And then our certified nursing assistant, who basically does paperwork and pharmacy runs and things like that, can't actually provide care to patients. That one is filled right now. I have provided to Robert, I'm not going to spend a lot of time on this, a summary of all the medical duties that they do. So when you have time to do that, I was hoping that would give us a little more perspective on just the extent of everything that they have to do. I've also sent out some stats. You'll notice these are from June of 2020. That's because that's as far ahead as they've been able to work at this point, because every minute they spend on that is stuff they can't spend on patient care. But going back to June, when our count was about, right now, that was when the count was averaging 201. Right now, we're today 295 on average for this last 30 days. Just some of the 557 of the initial intake medical screenings that they did in that month. 55% of inmates had medications they had to manage. 38 full in-person assessments that were here past the 14 days. 23 had to have blood work. 34 had to be TB, so these stats provide that kind of thing. 557 COVID assessments. That's somebody we tracked through the quarantine process. You got to keep in mind that means up to 84 of those beds are designated at any one time. Usually they're pretty much full that we're doing daily symptom tracking on. We did 31 individual COVID tests in June. So you can just about estimate that these numbers are all 50% higher right now currently. Plus we did 2 mass testings of everybody in the jail. One caveat I will add is that back in June, we were still taking people out of the building. We have now brought all of our COVID testing in-house. I don't have numbers right now on the total people that were actually symptomatic. I think we're up to about roughly 25 people total that have been identified as COVID positive. The medical requests that month, they answered 292 of those that weren't COVID related. $21.99 in a month, that was the number of medication distributions that occurred. That means $21.99 individuals. That includes one person getting it up to 3 times a day. That is not the actual number of meds distributed, though. Some people have more than one med that they take at a time. But I've provided a summary of all those types of things just so you can actually look through to see the extent of everything they're responsible for doing. I'm going to scroll down here. So my main concerns that we're running out of ideas or solutions to manage it. Okay, first of all, our lack of 24. Am I back?
You're back.
I'm back. All right. Sorry about that. I don't know. I didn't touch anything. We generally will have one nurse in the evenings, Monday through Friday, to come in and help with getting some meds set up, maybe help with med pass a little bit. Our inmate population situation, it's making it extremely difficult for the officers to be able to manage everything. With most pods only being able to allocate 1 person per pod. We have lost our classification system because 2 of our single cell housing units are designated for the quarantine status. Therefore, we are having to classify people into double bunk and dormitory type settings where they normally would not belong, which is creating a whole bunch of headaches. They know that we're not able to discipline the way we normally would and move people simply because those cells are already all filled. 612 intakes in the past 30 days, 572 releases, just for perspective. Every one of those had to go through that quarantine assessment process just related to COVID. That excludes any other medical concerns that they had. I would like us to start thinking of this facility while COVID's going on as basically 2 different facilities. While we talk about a capacity of 348, In reality, we're running an isolation pod or an isolation facility that holds up to 84. And then the rest of those 348 beds are people that have cleared that. What we're running into is having to, because we have more people than that 84 beds can maintain, can hold. Generally, we run a 5-day watch period where we're concerned that COVID might emerge. All the symptomatic people are held there, plus anybody that's been quarantined because of direct contact or testing. So what we end up doing is having to move people off of that 5-day watch early, quite often, almost on a weekly basis, down to 3 days and 2 days, so we can make room for the new arrests that we're expecting. We typically do that, especially on Fridays going into a long weekend. Our double bunk cells are running at near full capacity. Our dormitories are also at near full capacity. What this means is if we have an outbreak, we have no place to actually move the sick people to, because all of those cells are already filled with people that we're monitoring or are symptomatic themselves. Okay, we have no signs as of this point of an outbreak, but we're starting to see with the county an increase in the number of people that are contacts. Obviously, our staffing numbers show that. For perspective, the DOCR notified on Friday that they are suspending all intakes into the facility. They have an outbreak they are dealing with as of the 16th. They have 37 staff and 43 residents that have tested positive in the state prison, and they are still waiting additional testing results beyond that. So they are going to still take out the 3 that were scheduled to leave this week. They're going to place them in a jail out west, similar to how we've been housing some people out west. Not sure which one, they haven't decided yet. But after that, they're shutting down their DOCR moves as well. So that's the contextual stuff. So what do I think I need? First, sometime in the not too distant future, I would like, as the sheriff said, to be addressing the way that our nursing staff is structured. I understand that we're having difficulty even filling the allocated positions we have, but when you look over the list of everything that they're responsible for, once we can actually establish how many times they do each of those things and how long each takes, I think it would become readily apparent just how deep they are, and not at all prepared to actually deal with caring for people that become extremely sick if we have an outbreak. Our inmate population right now is only increasing the chances that it would be a widespread outbreak if we have one. If you recall back in March, we had initially presented a plan that would target a capacity of 186. That would be with the notion of single bunking everybody and not using dormitories. That obviously is not a reality for us right now. Outside of finding more beds somewhere or reducing our population, I don't see any way around that. But I just feel like we're playing with fire here, especially considering all the protections that the DOCR took, and you can see the boat that they're in right now. So that's only going to get worse as people start getting sentenced to prison and end up backing up again. The behavioral stuff, one thing immediately that I would like some permission to pursue, I don't think it would cost us somewhere in the neighborhood of maybe 50 to 100 grand, but when I look at our inmate grievances, about 75% of them, not only are they double this year what they have been in the past, 574 to date, but they're about 75% either between medical or meal service. Feeding these guys a little bit better, I think, would go a long way towards behavior, keeping them fat and happy. So I would like to pursue with our food vendor to see if we couldn't increase portion size. It would cost more, but that would be an easy way to buy a little goodwill with some of these guys. Right now, one officer is having great difficulty. When you look at the list of what charges people are in for right now on quite a few of our people, it's way higher, more severe charges than we've ever dealt with in the past. I think we've got 9 in for murder right now, probably 7 or 8 in for attempted murder. I mean, there's a lot of serious offenses, people that absolutely need to be in here. But mixed in with that, we've got a lot of people also in here for really minor petty stuff. And I know there's difficulty they're dealing with downtown, but we're, when I'm hearing us talk about stuff like we should get the marshals out. Marshals, the federal government only holds people that they've deemed aren't safe to be released pre-trial. They do not operate a cash bond system. So the ones they're holding in here are the ones that they've deemed dangerous or risk to flee. And we're holding people in for things like failing to pay fines and lying about their name. And it's just, if we have an outbreak and we're forced to reduce, it would seem logical for us to approach the judges from an elected official to elected official stance and say there's got to be some room here to not bring some of these folks in. some other alternative way to manage these cases, because we're getting people, I don't know what the numbers are, I'd have to run it, but any relief we could get for that, there's a number of people that are being held in here, and if they're gonna get sick, I don't know how we're gonna manage it. For the future.
And Andy and the sheriff, just a quick question. Are we talking about the same people here that I'm hearing Andy say, these are pretty, in the grand scope of things, minor charges, and on the other hand, Sheriff Johnner is getting hammered when he goes to the community meetings that from the downtown association folks who say, these are the folks who are annoyance and you need to do something about it. Are we talking about the same people there?
I think we could be. You know, it's going to take me 2 hours to run in a full analysis and print off everybody's current charges and summarize that for you. And that's a real-time thing. Back at the beginning, I was kind of doing that on a daily basis, but I can only imagine what's the outcry going to be if we have a mass outbreak that we can't manage and we got people, you know, if we fill the hospital, you know, let's say 10% of our population needs to be hospitalized, and now there's no room for public people for something that we could have prevented by reducing the population. That's going to be a tough one to explain as well.
I'm not asking you to run that number. That was more or less an off-the-cuff answer.
I can do it, and you can actually see. But I mean, if we're going to approach the judges to give them a realistic understanding of exactly what I'm presenting here, I think we have to show them those, and who are we suggesting that they should reconsider. City's doing a lot of that. You know, anecdotally, one person last week, you know, it was a failed to pay fine warrant. They lied about their name because they knew they had a warrant. That person sitting pre-trial for probably at least 8 weeks until their next hearing on $800, which they'll never come up with. That's the kind of thing that doesn't present any kind of public risk other than probably not appearing in court, but it's taking up bed space for us. And if that person gets sick, they're going to kick them anyways.
And I think that's probably a conversation for me to the judges. So can you go into the medical portion or that work?
Well, that's what I mean. This all ties together. Medical can't take care of those with what they've got. So if you want to look here, I'll call up this summary. Let me share this with you guys here. Sorry, almost there. And I sent this to Robert so that he can redistribute it. Just all the duties that they're having to do each day. So we've got intake of prisoners, 22 per day. There's a whole lot of things that they have to do, this whole list of things for each one of those. The individual assessments up and booking, these are the types of things that if we had 24-hour coverage, they could probably stay ahead of them sooner. The COVID evaluations on everybody, I mean, imagine if they're also gonna have to care for sick people on top of this. Isolation monitor, we're doing this for up to 84 people a day. They have to do twice daily symptom tracking of everyone. Officers are helping out with quite a bit of that. The COVID testing that they're doing, assessing everybody for need of that, and then moving them all around. The actual patient care that they provide for those that are symptomatic. Medical requests, like you saw, we're getting about just shy of 300, probably 350 of those a month right now that they're having to respond to. Those are for other medical needs that just pop up. For perspective, we've had, I don't know how many people in the hospital this month, probably it's like close to 6, I think, that have been actual hospitalized.
Andy,
yeah.
Just ask if you were fully staffed with nursing, how would you be sitting?
I don't think that's I guess the point is that even the nurses that we have right now are struggling to keep up with everything that they're having to do. That's what, we have one vacancy, which I guess, would help them probably see more of these people. But when we go back to something, they always have to delay something. We have a list right now of I don't even know how long it is, but the waiting list to actually see the doctor is measured in a matter of weeks right now. That's a function of how often the doctor can come out. We're seeing a number of things like x-rays that aren't happening for a couple weeks at a time after they've been requested. Just finding time to find somebody that can take somebody in to get an x-ray done. the number one thing is I think we're seeing an increase of people going into the hospital simply because of how long it's taken before nursing can get to them, and then conditions deteriorate even worse. You know, just as an example, today we've got people that arrived on Saturday night that were still pending their initial COVID assessment as of this morning, because medical came back in Monday and they have to get organized and then figure out where to start. And then they're just a backup since Friday of being able to get those done.
I just wonder if having a medication aide instead of a nurse would be helpful. Somebody that's trained to pass meds.
Yeah, I think having multiple people to do that might help. You know, one person is not going to cut it simply because we've got 7 days a week, Monday morning, noon, and night. And you know, when I explained it, right now we're getting it done on time basically by having the housing officers in each of their pods do it. One person to do the whole facility, I don't think can get to everybody within the 2-hour block that we have to get meds passed out.
Sure.
Andy, could you kind of go ahead.
I was just going to say 2 people going in 2 different directions dedicated to only doing meds would probably be sufficient. And we could help out, you know, on top of that.
Well, and I guess that goes back to that contract that we have with Cass Public Health. I mean, if we have a contract with them, it's their job to make sure that we're staffed.
Well, it is, but you have to keep in mind though that the way that is billed, I'm trying to get this back up now. The way that contract is set is it's up to the commission to decide how many nurses are necessary and then to fund it, right? They are not giving us an assessment of how many they think they need. They're staffing it, dedicating people to it based on what we've agreed to pay in salaries. And in the past, I mean, this is long before most of you were on the commission, but when we've come at budget time and we've in the past asked for 2 and then they've made a decision to give us 1 part-time, you know, that's not a decision based on stats or need. That's just a decision based on what we think we want to allocate. And right now, by paying it just for salary for the 7 or 8 people that they hire to do it, it doesn't provide for any kind of accommodation if somebody's gone. So when Heidi is gone for breast cancer or now for her surgery on Wednesday, there's nobody coming in to fill her place. When Conrad gets deployed in January for a year, he's on the salary, or for a month or whatever it is, there's nobody coming in to fill for him. When somebody's out sick, we just do without and we make it up with officers helping out.
I don't understand that. If we have a contract with Fargo Cass Public Health, if somebody's out sick, then they should be putting somebody else in their spot. I mean, I agree that's what we need, and that's what we need to approach them about, but the way it's budgeted is to pay just for the people's salaries who are assigned out here and nothing more. That's just the way it's budgeted.
So what you're saying is the budget doesn't allow for people to come out and fill their spots when they're gone. That's what you're saying, right, Andy?
So, and the contract itself is not for them to fill X number of positions 7 days a week. It's for them to designate 7 people to work out here, is the way it's structured right now.
Commissioner Pollock speaking. So do we budget $800,000 a year for Cass Public Health? Is that what the number is? Robert, do you know about off your head?
I think that's roughly accurate. I can't give you that exact number, but I think roughly that's about it.
Commissioner Pollock, I see Michelle looking that up for us, so hopefully she'll have that answer for us here shortly. Go ahead.
So we certainly can't blame Cass Public Health because we have this problem, but we do have to look to them as a solution, as helping us with the solution. Are they aware of the problems that we're experiencing?
Yes.
Yeah. At what level? At what level are they aware?
Commissioner Pollock, following the meeting a couple of weeks ago, I have been in contact with Assistant City Administrator Mike Rodlinger. Told him, really explained to him all of our conversation and that we had some really immediate needs. With long term, we need to restructure this contract because we need to. I think we need to assure some better coverage there. But that we also are facing some real pinches right now, and so that has been communicated to city administration. and I don't know how quickly we're going to get movement from City Hall on that, but I've just reiterated that message here earlier today before we came onto this meeting, looking for any update that they can provide.
Thank you.
Mr. Pollock, it looks like currently our 2021 budget for nursing is $616,560.
616,560. Okay. Andy, do you want to kind of give them, and maybe commissioners, maybe you guys mostly understand this. I was going to maybe just have you give them a rundown of, you had it on your sheet how many people we have and how many we contract for, but I know like Commissioner Sherling had a question earlier on that was explained to her as far as like why we don't have coverage into the evening, why if we have like, 5 nurses, why are a majority of them working during the day? Maybe to kind of lay it out for the other commissioners so they understand why it's set that way and stuff.
Well, I think that goes back to, if everybody could take a good look when Robert sends it out of that summary of all the duties that they do, you'll see that a vast majority of those are things that have to occur during the day anyways, because they're having to consult with other people while they're working. And quite frankly, everybody that's here during the day when they're here is already working on something every minute of the day that they're here and things are still getting way late, put to the wayside to maybe get done later. I just don't think there's, with the number of things that they're tasked with doing, that reallocating and rescheduling people is going to make a dent in anything. It's just going to be pushing the problem onward, and less things will get done during the day that are currently getting done now if we did reschedule them.
Sure. So how long are they there during the day? So why, I'm wondering if maybe they have the question of why wouldn't they be helping pass out meds at night? So just kind of an hour type thing, like when they're on their hours run?
They're generally scheduling one to come in later in the day so that they can stay until like 10 o'clock. So that one nurse, while they're here in the evening, will probably be able to get done roughly a third of the pods for the med pass that night. And then the rest of them start. So they have a schedule worked out where one of them can be here Monday through Friday in the evening. And then usually they have one that comes in and covers either a morning or an afternoon on the weekend. But
so do you also pay additional fees to Fargo Cass Public Health for some of their administrative positions, for their director? How does that cost share work? And maybe Rick knows. Rick sits on that.
I do not have an answer to that.
Commissioners, I know we have some calculation of a proportional expense. I don't have that exact calculation off the top of my head. I can find that and share that with all of you.
Well, and we have very little input. I mean, we have this figuratively, I think, board, but we have very little input in there. If they have salary increases, cost of living, it's really, we have very little input into that. So I don't know. I'd like to have us relook at our whole agreement with Fargo Cass, and West Fargo does not participate. Is that correct?
That is correct. That is that's a rabbit hole I've run down a couple of times, and there's some long-standing structural things that go into that I can't tick off the top of my head, but I know that that's a long conversation of why that is not, why they're not a paying entity on that, but that is true.
Well, those are
so Andy, I think that we should be focusing on what the solution is, because we all recognize there's a problem. But in our 16 minutes that we have left, how do you propose to resolve this?
Well, from my perspective, we need more nurses, whatever it's going to take. And I know there's a lot of competition out there. and public health probably couldn't reallocate them right now with what they've currently got because, you know, they're all neck deep with all their COVID stuff they're having to do. On top, you know, having more is the only solution for the population we have. If the population were to decrease somehow, that's less that they have to do and it becomes more manageable.
What control do we have over the population?
Only whatever we could convince judges to change how their practices. And right now that's
and tell me about how that conversation has gone.
So far, I mean, you can see where we're at.
There's no conversation, is there?
We have to go back to the table, Commissioner Pollock, and visit with them. We had that conversation with our judges back in April and May. And we need to go back to the table and visit with them a little bit. We've done it here and there periodically, but not getting everyone at the same table. And I'll take care of that. But we definitely need to go back and do that.
And then let's Robert get back with Mike Edlinger.
Yes. One other point I would just throw in, Sheriff, talking to Birch, I know that he's got some interest in revisiting the court schedule questions a little bit now with the COVID numbers. My understanding is that Judge Rasick is out of the office for some period of time. I don't know how long that is, and so getting any kind of a word on managerial actions on the court level probably won't happen until Judge Rasick is back. But I know Birch has some issues, some pressing issues for him as well.
All right.
So, Sheriff, I have a question for you too.
Yes, go ahead.
Can you or can the commission and you issue some sort of a directive that we're not going to be accepting prisoners? Because I mean, that's what it comes down to is if you run out of place to put them, what do you do? And so, is there a trigger we can trip?
Well, I think that's what I'll have to use in my conversations with them, is to let them know that if we get to a certain point, we're not going to be able to take anymore. And, you know, and then really it comes down to, you know, who they want to be in there and who, you know, who's the rest of society and who really needs to be in there and what other options do we have. So, you know, for me, that's part of the piece. I mean, obviously I want to work on a solution going forward, just like you brought up. I'll go to the table with them. I simply, you know, I don't know that they're going to let like 30 people out by any means, but if we can get a little bit of breathing room. What I do think that we do need to look at the contract and be able to maybe fill some of these positions when people are gone. If we could look at the contract that way, that's obviously going to cost us a little bit more money. Wasn't anything that I put in our budget for next year, but you know, when this person's deployed on military leave, or when Heidi is out having her surgery because of her cancer, it would be nice for someone to come in and take that position when they're gone, because we're really having to adjust as the correctional staff, our correctional officer staff, and trying to fill those voids. And where I get real concerned is our staff handing out medications when they have no medical knowledge. Like I said, they go through our med passing training. But sometimes it comes down to really understanding or having that medical knowledge to know, you know, the different pieces of that particular job. So,
and that goes back to our contract, though. I mean, if somebody's gone, then they need to pull somebody from a different area. Maybe it's a supervisor that comes out and passes meds a couple of nights while somebody's sick. I mean, it shouldn't be our problem if we've got a contact with public health to take care of this.
All right. Well, so I guess my question would be, is obviously you've reached out to Mr. Redlinger, Robert. How do we get people back to the table to look at the contract? Is that what you're currently doing with him, or do I need to make that connection with Desi, or what?
No, I will make the contact again that says we need to have this, expedite this contract ASAP, whether it's the contract language or it is doing something in an interim basis to bring be able to fill these shifts as other people are gone for a variety of reasons. We have immediate needs that are rising to the level of overall community concern and community health.
Okay, so then what did that constitute? You, myself, and maybe Mary and Rick, since he's on the board, just sitting down with them and then getting an overall cost of how much more that would cost us, and then bringing that back to the commission so that we can lay it out so everyone could see how much more that would cost us to change the contract that way? Is that what we're...
Yeah, I think that's a good first step. I think part of that conversation on their end is going to be availability of people, because I think they're competing in the same marketplace as a lot of these health systems now that are scrapping for every trained person they can find to meet needs right now. But I think we do have that conversation to say, what can we do in a now time frame?
And
And
Sheriff,
I think the now time frame, I think is we shouldn't hesitate to contact the health department if that's our only avenue. We also probably have other avenues, and obviously funds availability is not an issue for us. We did receive almost $6 million in CARES Act funds. We have the money to do what we need to do and do it right at the jail. That's what this money's for. It's not for necessarily building projects and that type of thing. But if we need to use those funds to take care of our current inmates in the jail, and we need to use the funds for that.
and I was just going to say that I think I bet you that Desi doesn't even know of the crisis situation that is looming in the jail, because it doesn't sound like there's been any communication regarding that.
No, Commissioner Pollack, she doesn't, because I simply brought this forward to Mary and you guys first, because I wanted to visit with you about it to see how we wanted to proceed first. I really didn't want to go visit with her about contracts and stuff like that at the same time that I would talk to her about the issue. So that's why we wanted to have this meeting. But yeah, we do need to make her aware so she understands it, obviously.
And what about state inmates? Anything we can do there?
So two things on that. One, I want to take 60 seconds here to talk about the state resources that we're supposed to be getting, because the psychiatric care is something that's piling up for our medical staff to have to deal with as well. I'm going to share one more thing with you. The way that we're structured for state psychiatric through Southeast Human Services is a doctor that's supposed to be getting online through telemedicine every Thursday. So for 2020, all the pink highlighted ones that you see there are the days that she canceled on us. Couldn't make it, sick or whatever it was. In 2019, that's what there's some months where 3 out of 4 weeks she's not doing it. So everybody they're under her care just aren't getting seen, and then those problems pile up and our nurses have to deal with. We got to address that with the state. I know last time when we talked, it was the same thing 2 years ago. We're just not getting anywhere near the medical care or psychiatric care that they're supposed to be providing. As far as the state, I don't know what the options are on that. Those people are getting sentenced by our judges legally. They're very, very minimally sentencing people to prison. We sentence far fewer out of here than any other district in the, per capita wise. And that is what it is. Unless the governor orders them to start taking them, I don't see any way around it.
So Sheriff, what would happen if you had six DOCR inmates in a van and you just took them to Bismarck and without an appointment and said, "Here's your guys"?
That's a good question. I've never tried it before. I might bring you with me if you want to go with. Well,
if we could do it safely, I would do it.
Yeah. Chad and I have actually talked about that before, believe it or not. So, I don't know. Obviously they're in a tough situation right now as well, but by that psychiatric thing, I don't know at what level that conversation happens, since it's at a state level. I don't know. I'd actually be looking for guidance on that one.
So do we contract with the state for that position?
No, that's not that is representative of all the people that Southeast, under the state guidelines, has taken on as patients. Either they were already active patients before they came to jail, or they meet the state criteria for the state to provide services. Those are people that are getting screened for, maybe need to go to the state hospital, or are in need. They meet the criteria as established by the state Century Code. And then they are responsible. Being in jail doesn't affect whether they become a patient of theirs or not. And that's reflective of the doctor that they've dedicated to provide care to people in jail 1 day a week, how often that appointment is getting canceled, so those people just go unseen. She doesn't see the same patient every week on that. You know, of her entire caseload, each person might be seen once a month of all 4 or 5 of those appointments. So then they just get pushed back further and further for med reviews or whatever it is. And they've been doing telemedicine on that well before even COVID started.
Do we pay the contract for that? Or?
We don't, no, that's all partly funded by the state. That's just people that are going unseen. So then our nurses have to deal with the aftermath of that and the things that deteriorate. And that's partially why we took on the additional private contract with our doctor from the VA. And that's partially why we had to double the contract for next year to double how many people he's seeing.
Commissioner
has had his hand up for quite a while.
Commissioner Peterson has a comment, and then I'd like to make a comment. I know we're getting close to the end here.
Hi, everybody. Yeah, so Southeast Human Services, that's a state function, needs to get rethought in and of itself. The total programming mix they do is not the best, and I think what they have is they have the staff that needs to rethink what they're doing, and that's a big state conversation. Inmate count. If we've got people in jail right now for a day or a week because they've been lying about their name, that to me just screams of community observation. Those 20 or 40 or 15 people, you allocate another officer towards that, you get them out of the jail and you get them at their house, get them working, get them back to their family. The nursing, we don't need to rethink the contract. What we need to do is have them fulfill their contract they have. If we need to do anything, which I'm skeptical we do, but if we do need to do anything, we talked about, well, I think Commissioner Pollack brought it up last communication, was hire one more full-time nurse to have that person, that man or woman, sort of serving as an extra piece. So if you have the person wash out, you've got one more staff person there. State inmates, as Jesse ended with, Sheriff Johnner ended with, I'd be happy to sit in a car. Laney and I talked about this too. Drive them out there, park them outside the door if it gets to be that critical. That's all I have by.
Okay. A couple things. So we obviously need to look at the contract thing or talk to Desi about that. So I'll get together with Robert and Rick and Mary and do that. I'll have my meeting with the judges. That does seem pretty easy, Chad, what you said. I'm not saying that you didn't think about a few of these things, but we can only put so many people on some of those programs because of just pre-trial and who's involved in working together with us on that type of thing. So, but we'll work through some of that. Let me take care of that as the sheriff. So you don't have to worry about it.
I would just jump in real quick here, and I will move the conversation as quickly as I can with City Hall with an urgency here that we got a problem now, and we need their assistance now. I think with the current language right now, I think we have an issue where we do not have a contract for full-time coverage. We have the contract for this position, and when that position goes on leave or is on vacation, we don't have a contractual obligation to fill it. That being said, we've got a need, and I think we've got a partner here that will help us work through that if we make it clear how critical the need is. Number two, I hate to be the thorn in the side here, but I'm going to go back to number of federal inmates. And as far as I understand, when we're busting at the gills, and we need to look at every option we've got. Sheriff, my understanding is we have a contractual obligation for a certain number of federal inmates, and we have well more than that number in right now. And I understand there are some challenges there. It might make some relationships a bit difficult with maybe the Marshal Service or some of those other partner agencies. But if we have a contractual obligation to meet X, and we are scraping for every bed, I'm not sure why we're not getting that number down as close to X as quickly as we can.
Well, because what simply is the case there is a lot of the inmates that we have here are federal people that have been sentenced federally from our area, They're not people that have been brought here from different parts of the country. So I think where we're going to run into kickback, very much like when we just had the protest, U.S. Attorney Drew Wrigley agreed to take some of those people and charge them federally instead of put them on state charges. So either way, they would have been in our facility, because if he wouldn't have taken them federally, they'd be here on state charges. He decided to charge them federally. And that's really the population we're looking at. It's not people that have been brought here to house to take up some room. They're people that have been sentenced on federal charges, drug charges, those charges, and they're here in our area because they've been charged in crimes in this area. So.
All right. Well, I think we all have our list of things to do here. So anything else that anybody needs to jump quickly into?
Thank you, everybody, and if needed, I'm happy to be sort of a distribution point for information as you learn more on any of these conversations and want to share it to the group. Please loop me in, and I'll make sure it gets distributed.
Okay.
And
some of these things will be touched on again at the commission meeting later today.
Yep.
And I'll get working on my end to get some of these things put in place so we can get going, and I'll keep everyone in the loop as we go.
Okay.
Sure.
Thank
You
you.
want to meet again in 2 weeks?
So if you guys want to, we can.
I think it's a pretty important.
Yes. Yes, please.
Sure.
Okay.
You're gonna have three meetings that day, then in addition to your commission meeting, just FYI, because we need a flood sales tax meeting too. So just telling you.
Maybe we do that another day.
We'll figure it out.
Yeah, we will figure it out.
Okay.
Okay. Thank you, everybody.
Thanks for your time. Bye.
See many of you in a few minutes.